common fact that working out and eating nutritional foods leads to improved physical and mental health. Imagine that we're trying to get into better shape in order to lead a healthier lifestyle and want to go to the gym.
But we live in a high crime rate neighborhood and don't feel safe going to the gym at 10 o'clock at night, the only time that we have after going to school and then to work, just to help our families pay rent.
Even when we try and make healthier food choices, we have to make the hard financial decision to buy the 99-cent of unhealthy potato chips instead of the expensive $4 bag of grapes. This harsh cycle is the reality that millions of Americans face every single day. Good morning. My name is Ella Kate Brooks.
And my name is Madeline Friday. And today we are here to have the necessary discussion on how poor social determinants of health continue to plague our communities and what we must do to amend this.
Social determinants of health are defined as the economic and social conditions that influence individual and group differences in health status. In recent years, healthcare has become more and more politicized. There is virtually no bipartisan consensus on the type of healthcare Americans are entitled to. When you break down and analyze the trends of Americans who routinely go to the doctor and have access to high-quality healthcare, the constituents are generally older, whiter, and wealthier. The groups that have the lowest rates of healthcare coverage?
African Americans, Hispanic, and Asian populations. Why is this?
It's because families of color and low socioeconomic status are systemically denied access to affordable private healthcare and more commonly depend on public healthcare options. But even public healthcare options such as Medicare are deeply flawed.
People who depend on Medicare are not covered for dental care, long-term care, or even prescription drugs. Why publicly subsidized healthcare attempts to address the inequality that social determinants of health causes, there is significant room for improvement.
Congresswoman Alexandria Ocasio-Cortez once said, "In a modern, moral, and wealthy society, no person in America should be too poor to live." When are we going to realize that basic healthcare services should be a right, not a privilege? When are families not going to have to choose between paying utilities and sending their child to the dentist? We as a society must also address the differences in quality of care. According to a study conducted by McBean and Gornick, African Americans covered by Medicare were statistically less likely to receive 16 of the most common medical procedures than their white counterparts. How can we ever expect social determinants of health to improve when inequalities are deeply weaved into the ability of minorities to lead healthy lifestyles?
While this needs to be a nationwide conversation, we must also acknowledge what is happening in our very own state. From 2018 to 2019, the percentage of Alabamians that were uninsured rose from 9.4% to 10%. Now in 2020, the COVID-19 pandemic is exposing just how vulnerable uninsured Americans are, specifically those that are subject to poor social determinants of health. We are at a point where more Americans need to go to the doctor at a single point in time than ever before. One emergency room visit for somebody who is uninsured can cost anywhere from $150 to $3,000. This can motivate those without health care to avoid a pricey trip to a physician, leading to overall health getting worse rather than improving with proper treatment.
So what do we do now? We educate and we advocate. It is no secret that big pharmaceutical and healthcare companies make their products difficult to understand and therefore can intimidate consumers. If people that are subject to poor social determinants of health better understand the options and resources available to them, then they might be able to better navigate how to lead a high-quality, healthy lifestyle. One factor of a poor social determinant of health is not being able to access a learning environment that is up to standards. This can immediately discourage someone from trying to learn more about their healthcare options. If we work to remove the stigma around complicated access to healthcare, then at the very minimum, we can at least be aware of what is on the table.
The next step is to advocate to improve the overall health of communities that do have poor social determinants of health. By going into local communities, we can talk to residents about what they need to lead healthier lifestyles. The neglect of communities impacted by systematic denial to affordable and quality health care can no longer continue. We plan to partner with our local workout center to lead free workout classes in low-income housing neighborhoods twice a month, give a presentation on how to budget grocery shopping to be able to afford healthy foods, and volunteer at an after-school tutoring program that takes place in a neighborhood where many students are unable to afford extra help with their education.
Now, while we acknowledge that these efforts will not erase the crippling social determinants of health so many are facing, it is the next and necessary step. We are all Americans, and we all deserve to be able to lead healthy and happy lives.
Thank you.